difference. I gonna ask my mommy to change my name, yes, because And by the way, happy birthday, mommy.
Big up to your mom.
Big up, mom.
I understand you went to
Birthday today?
No, on the weekend.
I understand you went to church yesterday.
Yeah.
So did I. Did you go to church? So you didn't sense the two of us going to church?
And
I decided, Jeannie?
no.
I went to the gym. So then I watched some football. Then cooked.
Morning, Liverpool fans.
What
Yeah,
was the name of the church yesterday? Or you just sensed that?
That me?
Yeah.
Just
Why did you go to church yesterday?
Just felt like going, man.
Bro?
Yeah, seriously.
Okay. Which church you went to?
Faith Temple.
Faith Temple just down the road from you.
No, Faith Temple is Montrose.
Oh, sorry. Yes, yeah. What made you go there?
It's my mom's church.
Okay.
Aye.
Man, the only church I go to is Pastor Daniel. Man.
No.
got the swing,
True.
yeah.
Swing, man.
Boy, I saw Luke. I fight. But anyway.
All right, reading from Eyewitness News. Lawyer says prosecution withheld Oh, sorry, wrong story.
Boy, we come back on that one. Boy.
Let me give you a different one. The NDP said that they would expose some things in a briefcase allegedly against the ULP.
That was the case files.
I think this is the first thing out of the briefcase.
Otamo?
I think I get the impression that there's more. Reading from Eyewitness News, 144,000.
Hang on. Cummings stole Kishore's bag.
No, Kishore, like you distributed things.
Charity.
He opened it up. Who you are?
Yeah, you want something?
You want something?
Yeah.
Take something,
Read
man.
that. Yeah.
Take something for help.
Yeah.
You want finance?
Yeah.
You want finance?
Look at that. Look at that.
Agriculture? $144,000 contract between government. Walters, a disgrace, says Cummings. You wondering who Walters is?
I don't think this is alleged. According to the eyewitness report, that he has a copy of it.
Yeah, okay. Well, the government of St. Vincent Grenadines has awarded an EC $144,000 one-year contract.
With a T.
With a T. Which one is the T?
The 1,000.
Oh. To hospital administrator and Unity Labour Party candidate for North Windward, Grace Walters.
With a G.
To advise on a reform of the healthcare system.
So, according to the Eyewitness News story, Eyewitness News states a copy of the contract obtained by Eyewitness News shows that it falls under the Strengthening Health System Resilience Project and runs from January the 15th, 2025 to January the 14th, 2026. Contract is signed by Walters and the Director of Planning, Ricardo Frederick, on behalf of the government, while two other people signed as witnesses. Now, let me understand this, right? When you're a public servant and you're now allowed to run as a candidate, and then when afterwards you go back to your job, right?
Mm-hmm.
Is it unpaid leave? Presumably.
I think so. I actually think in the story it says that she had to write to the Public Service Commission,
Mm-hmm.
and then they put her on leave.
Right. And that would
Right.
pay.
Right. Well, no, I don't think you get.
I don't think you would get paid.
All right. But then, therefore.
So was this just a convenient way the government found
To pay her.
to keep paying it?
If you break down that 140, that is
$12,000 a month.
a month.
Yeah.
12,000.
Not
12,000 a month.
bad.
They ain't bad at all.
Not bad.
For staying home and going to talk about, we don't talk about
She was probably on something similar as the hospital administrator.
right, she's still
Oh,
getting paid.
But is it just a way to ensure she keeps
She gets
getting
paid.
paid? So, because otherwise the party would have to fund it, right?
True.
Because I would have living expenses, regardless of whether I'm running as a candidate or not. I still need to live,
Yeah.
right?
And if I don't have a
Which
income,
is a deterrent for I'm sure somebody like Shaka,
who has to give up his
who has to give it would be one of the reasons why he couldn't give it up earlier.
Yeah.
because he still needs to live, right?
But at the same time, right? Is it that does that kick in as soon as you declare for a party, or is it that when you get nominated like today?
No, I think I don't know, but I presumably you have to take time off if you want to campaign.
Right. So when you take that time,
Why do you?
Well, because otherwise you'd have a full-time job.
If I'm working 8 to 4, I don't necessarily have to
campaign any
campaign during that.
No, you don't, but you probably are. Right? So I suspect you have to give them a date and say, look, you know what I mean, I want to take leave from this date to this date. Right? I'm back to work. If I'm not successful, back to work on the following Monday or whatever, right?
Where's the peace?
But I'm guessing that you don't get paid, but this looks like a convenient way government use government funds to get around that.
To keep the candidates happy.
Yeah. Because otherwise the candidate may be reluctant to run, right?
12K a month, ain't bad.
And I'm guessing the party doesn't want to pay it out of their coffers.
Right.
Man, 12K a month.
Is this corruption?
With a capital C?
Technically, no. Technically not. If she, I think, with a doctorate in health administration or whatever it is that she has it in, and high qualifications in nursing as well, one could argue that she is qualified for the job.
So she's not going to go back as the hospital administrator at some point.
No, I think she's just temporarily on leave from hospital administration,
and she'll just take the year off.
Yeah, but hold on. We are saying that as if she getting a salary. This was awarded to her for what?
It's a contract to
This is a
advise.
contract. This is an advisory contract.
Okay. So how does that differ
From
her getting she's on no paid leave?
I'm guessing.
All right. So if she's on no,
It's just a way around it, huh?
Right, but somebody says, Grace, or Dr. Walters, said she took an unpaid leave to complete her PhD. However, what her and the government did was find a loophole for her to still
right.
collect money.
But this is it.
Right. So it's a kind of convenient way.
So yeah, it spells a little corruption there. No, yes.
This person wants to know if there was a tendering process for that contract.
I'm gonna question that.
I'm not going to talk. So these were my somebody. I need a horn. Somebody.
I think there's a truck horn in here somewhere.
Man, I want a horn. I don't care if it's red or yellow. I want a horn. I want one. I don't care if they can give me two. I want a horn. I need one. That seems to be the other day. I need one. Please fix in the
All right. So she I think this is just a way that they get around it.
So isn't that a little corruption-ish?
It's.
And that's the point I was making just now.
I think the PM would call it being strategic.
I think other people would call it the incumbent's advantage.
Yeah,
I would call it corruption.
Yeah.
Look, I think
potato.
I think what it demonstrates though is that when it comes to healthcare, the business of health for people takes a back step to the needs of the party.
What was the money awarded for?
So
It's like an advisory.
Right, but
It's a consultancy job.
okay, good. And when we look at the state of the hospital, when she got that money?
it started this
Started in January.
Oh, well, okay, all right, okay, right then. Yeah, okay.
No, but I would say when I look at the state of the hospital, is she really the best person to advise on health?
That was my point. When you look at the condition of that hospital, I paying you for what? And how long?
If I'm looking for consultancy, don't I tend to look for like exemplary examples?
I'll tell you my biggest issue with it, right? My biggest issue with it is that you have somebody who's basically coming in to judge themselves. If I'm the hospital administrator, I've been the hospital administrator, a lot of my decisions impact healthcare. Why would I then go around and use me
Exactly.
to advise on
Exactly.
health? I'm not going to make myself look bad.
The story goes on. Walters is also to support the planning, implementation, acceptance, taking over operation and maintenance of the Arnesville Acute Care Referral Hospital,
Christ, we in trouble.
including transfer of services and equipment from the Milton Cater Memorial Hospital to the acute care, blah, 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 and ensuring continuity of services.
I will not put that responsibility in her hands.
Okay, so under the contract, Walters is expected to observe the project implementation to ensure consistency with the project development objectives. She is to support the implementation of all healthcare quality and patient safety standards.
I will not.
Look, man, I
am saying what I'm saying based on what I see down there. If
Yeah,
you've been the administrator for X amount of years, don't come and tell Celia Pickney now that
On
I'm
top
going
of
to
that,
entrust you with this. I can't.
Why would you hire somebody to judge their own work?
well, it's not just their own work. It's
It's partly their work.
part of their work. But she, I
Look,
mean,
look. Would you, if you want to make an assessment of Hot 97 and the quality of
I'm probably
announcing,
not the best person to do it.
but not just that, would you hire Chris or I
Yeah,
to
yeah.
assess the morning
The
show?
morning
You wouldn't
show,
do
yeah,
it.
correct.
It doesn't make sense.
But this
You
part,
could,
she is
yes,
to
you can.
support the implementation of all healthcare quality and patient safety standards.
Can't make sense, Luke. Sorry.
There is no way that hospital
Can't
there
make sense.
will
Can't make
pass
sense.
any patient
None. You know,
safety standards.
they keep saying that, oh, who winner? It's better to sell the damn hospital. You might get better service.
the
that is a bad.
No, I'm
word
telling
to say
you.
right now.
the accidents and emergency for a long time had toilets which didn't have a hand sink.
Yeah.
Really, like,
Remember,
unbelievable.
in my day,
I can.
when I was there, remember
Yeah,
when you were there,
Yeah.
I went same thing, and nothing had changed.
I can.
just the other day,
testify.
a piece of concrete fell
Going
through
to the roof.
I can testify to going down there, being sick, and there was no hand soap. There was. It was like
Correct.
It's like, well, how am I in a hospital? What do we? Sterilization
What
has
are
to
we
be like
doing?
number one.
And
Yeah.
I know I'm going there and hold my PD winkle, and I coming out.
I think it's definitely
How much other people hold them on?
I
And touch on my face.
yeah.
What we doing?
So you don't use the handle, you use your foot.
So you kick off me. Kick off.
Terrible.
Open the handle with it.
Ain't no way.
And I will give you 140.
But based off that though, would you? I mean, look. First off, PM, I would beseech you
implore with you.
to not let her be the advisory
Nah.
for the new hospital.
Nah, madness, craziness.
We're looking,
craziness.
we're looking for a change, right?
Craziness.
Hey, that's a bad
So
word.
then, and it goes back home again. So then, when you on your platform now, trying to convince me you care about people,
Yeah.
care about who people? If you are saying to me you were the administrator for, I don't know how much a year
I just
don't
think
know.
she is such a funny choice as a candidate.
Healthcare ain't something that the
ain't
government
that.
could clap about.
Yeah.
It ain't that. It is not that.
No, I mean maybe you can when it comes to
Affordability.
water, fresh water, and
Nah, I mean him clapping it for that.
clinics and those kind of things around the place. Maybe.
You know when I go start to clap it?
No, but remember that's not her job.
Right.
Her job is to manage the Milton Cater Memorial
And she
Hospital.
don't even do that.
And that's what I'm saying. If she had general thing over all of healthcare and she wasn't directly involved in the administration of Milton Cater, you might say, well, all right, man, we'll blame somebody else for Milton Cater. But that's her,
And that's the one people look at the
and
most.
that's
and
the
say,
one that we all have the horror stories about.
Yeah.
It's crazy.
So it is, to me, it's always been a difficult task for them to sell grace. Because you basically have
don't
to
sell
stop
grace, you sell
talking.
grace.
And then on top of that, I thought Chris was joking, right?
Oh,
Have you ever listened to one of her speeches?
that bridge give us responsibility.
There is an obsession over that bridge that was built in 2007.
Yeah, but again though, right? If you're in her shoes,
What else can you talk about?
right, and you spent the last 25 years managing Milton Cater, are you really going to be talking about that? I think I'll talk about the bridge as well.
Maybe.
No, for real. Because what are you going to say about the hospital without getting lambasted by the public?
We don't stop talking about the bridge.
Look,
PM, listen.
look.
PM is politically astute. PM don't talk about the hospital.
At all.
You talk about the new hospital.
More than him said sometime that he has go there regular.
He go there sometimes.
Lie!
Yeah.
Lie!
On his way to the airport.
Lie!
He didn't even say
Fly out,
something.
yeah.
He said he goes there often.
Yeah!
Which was like,
Lie!
Pernell Clark says 90% of civil get 3% for 3 months, and Grace gets $144,000. So labor is working for everyone.
Yeah.
Yeah.
But-
Quite everyone.
But going back to the bridge thing, I don't want to think on it too long, but if you were in North Windward or North Central Windward, kind of bridge that is now 23 years old.
Mhm. Be a savior.
How old is it now?
It was built fairly quickly in the first
Right.
term.
However long it is, over 20 years. 18 years old? Right. Can a party still run on that as
Yeah. But they're doing it. They're doing
No,
it.
but like if I'm living in North Windward and North Central Windward,
Jagger.
you've done this like over 15,
Jagger.
16, 17, 18
I
years.
mean, look. I don't think if you don't remember going through the river, it was a big deal,
Understood.
and I wouldn't take that from them, right?
Yeah. 18 years later?
Well, she wasn't responsible for the bridge. It would be the first thing I would say. All right, UOP were. But
Okay.
she wasn't responsible for the bridge, right? But you're the hospital administrator. I want to hear about healthcare from you.
Yeah.
I want to hear about what you've done for healthcare and what you're going to do for healthcare, right? And what I find when I listen to her is that basically she ignores that part of her professional career.
Yeah.
Hey.
Right?
Hey. Look on the bright side.
Isn't that a red flag?
Hey, what's wrong with a red flag?
Look on the bright
Huh?
side. The flag red, right?
Paula Nero on the live is basically saying the same thing. She's like, she can't campaign on her own merits because her track record is a disgrace.
Is that what?
Disgrace.
Oh my gosh. Hey, but guess what? That bridge! Get your personal.
I mean, I wouldn't downplay the importance of the bridge if you live north of it. It was important.
I wouldn't
right?
downplay it, right? But that bridge was built whenever. The last election campaign, they never come on that bridge.
You're insulting me.
Why?
Because look, the bridge is part of government infrastructure that is just necessary. This is like the whole road thing again.
Yeah, but the fact
I understand that it's important and whatnot. You can't be going 3 elections on one bridge.
4 elections.
on one bridge.
4 elections on one bridge.
On one bridge.
That is an insult. I've already paid my taxes to pay for that bridge. Stop. The bridge now old enough to vote. Thank you, Jeannie.
It's true.
Let's stop insulting people. That's an insult. That is an insult, Luke. Don't come with that. Don't come with that.
So you want to hear the hospital?
Talk about a new hospital. I'm surprised you're not talking about beaches. I mean, what? We cannot still be talking about the
If you
bridge.
hear the amount of thing that bridge give you, you get baby, it breed you, you get pregnant, you get prosperity shock.
It was a gateway to a wider world.
Wow. We have come back with a complex of Bickles.
I don't want to hear that bridge again. I don't want to hear it again.
Get your prosperity.
I don't want to hear it again.
Give me a break, please.
Bickles,